Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. So today I'm going to answer a common question that a lot of you guys have asked me, and I get to treat a lot of my patients too. It's a quadriceps tendon injuries or quadriceps tendonitis or irritation. So just to give you a little bit of anatomy and as to where that is and what kind of problem it is and why it's taking place. And also I'll show you one treatment technique you can use to get that better. So here's your femur. This is a model of the knee. So your femur is the thigh bone, and the bottom one is your tibia, the shin bone. And above that sits, and on top of those sits your patella, your kneecap. So underneath the kneecap through here is your patellar tendon, and the top part through here is your quadriceps tendon. So quadriceps comes and narrows down into becomes your quadriceps tendon. So that's where the area we're targeting. That's where you're having problems. So to show you on my knee, that's kind of like right through this area where you can have problems. So often with athletes playing sports where you're jumping or there's a quick movement and you come down hard on that tendon, and there's a lot of eccentric force going through there, you can have micro tears or trauma to that area, and which can result in scarring or thickening if it doesn't heal properly, if the tissue doesn't lay down properly, and circulation issues, which binds up that area, possibly resulting in tendonitis or tendinosis or some degeneration or wear and tear of that tendon. So breaking down those adhesions is an important thing in terms of freeing up that tissue and promoting circulation in that area, so you can, when you bend it or when you contract that muscle, you don't have that pain. In addition to trauma, or when you come down, as I said, quick on that leg, you can have repetitive strain of that tendon too. So runners often with a lot of pounding in that region, a lot of work through that region, or overtraining, can get quadriceps tendonitis or irritation type issues too. So one of the techniques you can use, and I've posted some videos in the past too, with cross-friction massage to break down the thickening and adhesions that form to that area. This is to I'm going to show you just another technique to do self-mobilization using, this is a lacrosse ball. You can also use tennis balls or it's a racquetball if it's a smaller area we're trying to target. So what you're doing is we're going to be doing self-massage, self-acupressure, and self-mobilization of that tissue to break down the adhesions, okay, and then promote circulation in that area. So mobilization part is, so here's the ball. I'm going to be targeting just above that area, above that kneecap, right? So you're going to be pretty sore through there. And not just that area, you want to kind of work all along that whole quadricep muscle, all the way up, in fact, even into the upper front of the hip. But since this is the main target area, you're going to work at just oscillating back and forth, look for those painful spots, okay? Outside, inside, so various positions. Spend 30 seconds, a minute on a spot and just kind of rolling back and forth, okay? You can even get to a position where you're going back and forth and then hold that spot and then bend and straighten that knee. So when I bend my knee, I'm stretching that quadricep, right? So I got some pressure on there and I'm stretching it, okay? You're going to get some deep pulling through there. Might have some soreness too, all right? So really spend about 3 to 5 minutes working on that tissue and freeing it up, okay? Now remember, first time when you do that, don't overdo it. 3 to 5 minutes, and see how you feel later that day, the next day. You're trying to assess and see how it tolerates it. So you might get a bit sore, but that soreness should subside after a day or two, and then you try the technique again. So if you overdo it, you're going to get really painful and irritate that tissue further, and it's going to be painful or sore for a few days, and 2, you might not want to do the technique again, all right? So immediately after doing that, mobilizing that, you want to do some massage to that area and use some heat for that area, okay? I posted some videos in the past about the importance of using heat instead of ice, so check out that video. You can even do some warm water soak for that region, okay? Put some Epsom salt, baking soda, and stick that leg in a bucket and put some warm soak on that whole